what's the function of the ligament? And you can't test that without putting your hands on the patient. We keep saying it every week, but it's really, really important that if you have an injury, that your physician's actually stressing out those tissues, putting hands on, and trying to see if that spot where you're reporting pain is the same spot where the actual anatomy is, right? Because just you have a partial tear, you might not have any problems with stability. Your knee can still be completely fine. Now, if you still have pain, that's a different story, but very, very important to put hands on patients.
And that is a real travesty, I think, in medicine, because when I ask, and I ask every single patient who's had a surgery, did your surgeon examine that body part? And once in a while, rarely, the patient will say yes. Mostly what they'll say is no. They showed me the MRI and explained that I had to have surgery or I would have arthritis. And what we find is as soon as someone has a surgery, if tissue is taken out, they have immediate arthritis. That's that's the definition. You know, it's tissue that's overgrown or taken out. That's arthritis. I mean, arthritis literally means arth is joint and itis is inflammation. But there's so many ways that can appear. It can be traumatic. It can be metabolic, like rheumatoid arthritis, things like that, psoriatic arthritis. But whatever it is, the cool thing is platelets and stem cells can usually help heal that. I'm going to give out the phone number, Dr. Grove, so we can get some callers and make this interesting because we get to talk to each other all the time. So the phone number to the studio is 866-870-5752. That's 866-870-5752. We would love to talk to you. We love our callers. If you want to call the office and get a free phone consult with our staff, you can call them right now. They're there. 800-300-9300. 800-300-9300. If their phones are busy, just leave a message and they'll call you right back. And if you want to really learn about this information, by calling in, you get a free copy of our book, Stem Cell and Platelet Therapy. It's got a couple hundred pages, 256 studies on regenerative medicine. Why to check that out first? Because it's conservative. You always want conservative medicine. That means no surgery, no drugs if you can help it, because those kind of things make people sick. Now, one of my sisters just texted me yesterday with the medicine she's on. She's on a slew of medicines that none of which she needs. I hope she's not listening to the show. Not one of them does she need. And, you know, I'm going to have a very gentle conversation with her about it because I don't want to tell anybody what to do. But I'm just going to mention my experience. Be conservative. You know, for someone like her, what I'm going to say is start with one of them and lower the dose and then get off of it and see if you feel better. Because what I find with patients is medicines don't make them feel good. Every medicine has a lot of side effects. There are some you need. If you have very high blood pressure, you better be on an antihypertensive medicine because you don't want a stroke. If you have atrial fibrillation, you want to be on a blood thinner because you don't want a stroke. Those are important things. But most of the medications we see people on are not good for them. We see a lot of people in our clinic that are on chronic anti-inflammatory medications or steroid medications that actually are hurting the joint. There are studies that show by taking anti-inflammatory medicines, you end up with more arthritis. You read about that, Dr. Grove?
Oh yeah. Again, especially when you're injecting these substances, it's even worse. And you guys can Google this yourself. Look at steroid and lidocaine chondrotoxicity. That's the fun word. Just describing that these medications actually kill off and wear out the cartilage much faster. Very, very well demonstrated in the literature. That's why we're really not big steroid guys. We don't like injecting steroids, even though they can't provide relief. Sometimes it's a short-term effect, right? It's a Band-Aid on the issue. And really what it does, it makes the problem worse. So it's a very typical scenario where, you know, they go to their ortho and they give them a steroid injection. Yeah, you know, it helped for a little bit, but then when they came back, man, it got a lot worse. And so now we've got the actual literature to support that. And so what we'd rather do is heal that tissue up rather than just cover it up with something that's going to numb it and cause long-term damage. So the oral versions, I think, sometimes you can argue they're even worse because it's going to affect all of your tissues, right? Looking at just your NSAIDs, your non-steroidal anti-inflammatory drugs. I remember working in the ICU, we get a lot of, GI bleeds, people that are on chronic, the anti-inflammatory medications that can cause GI bleeds. It can be really hard on your kidneys as well, send you into kidney injury, kidney failure. Again, especially when you're taking high doses and it's chronic, it's a bad move.
Well, I'm with you on all that. We speak the same language. So I'm going to give out the phone number again to the studio. You can call us live right now at 866-870-5752. That's 866-870-5752. You'll get a free copy. We'll mail it out for free of Stem Cell and Platelet Therapy. Regenerate, don't operate. Regenerate means to re-stimulate the tissue that's worn down, torn, arthritic, whatever that is. We can actually grow back the tissue and heal the area by using stem cells and platelets. Back in the day, it was called prolotherapy. It was sugar water. And people go, how could sugar water heal anything? It was what we called an osmotic shock agent. Wherever you did the injection, it would draw fluid from the area and actually kill a layer of cells. And that would create inflammation. It's a way of healing, but it's very weak compared to platelets. When that came around, all of a sudden the healings got a lot better. And then when the stem cells came along, much, much better than anything else. And we're open. If there's a new thing on the block that's going to work, we're going to try it. But for right now, we're finding that the stem cells and the platelets are amazing for regenerative medicine.